Praise the Lord, saints and friends. This is Elder Adrian Heyman. I just finished giving my wife breakfast, giving her medicines. And usually it's the same thing. She'll get up, she'll let me know in her own way that she's hungry. So I will give her insulin first, make sure she has that. I'll take her insulin count first, or her blood sugar count first. Based upon that, give her insulin on sliding scale. Then the medicines that she would take in the morning, I will usually give her those as well, followed by whatever breakfast I can get her. And after she eats, she'll want to lay back because she's on a hospital bed. So it can raise up, it can raise down. So I would put her down. Then she'd go to sleep for a good while. On days like this where she has to go to dialysis, then I would usually let her sleep until around that time. And she'll take her to dialysis, which will be about good 4.5 hours. About 4.5 hours. 4 hours for the dialysis itself. And another 15, 30 minutes for hooking her up and taking her off, waiting for her blood to clot so she can go home. It's funny that I know a lot of these medical procedures now. But I was thinking about a time when, before she had this major stroke, she actually had another stroke several months earlier. It didn't affect her gait or her walking, although, now that I'm thinking of it, maybe it did. Because every so often she would be walking and then she would collapse for almost no reason at all. And I have to really start watching her, and I started just putting her in a wheelchair if she had to walk any distance at all. I put her in a wheelchair, even though she'd get out the wheelchair and walk around if she wanted to. But I remember trying to give her pills. She had a lot of pills to take. And she would always take them at night. And that means every pill that I normally now spread out between the morning, noon, evening, and bedtime, she'd take them all at once. And she wouldn't like to take them. And I can understand why. Before I would think, well, why is she so adamant against me giving her any of the pills? She knows she takes them all the time. And now that I'm trying to be more involved in it, she would look at me and she'd be pretty mad. She would say, you're not a doctor. And that used to make me a bit upset because I'm trying to follow what the doctors say. And I know she needs to take her medicine, but she wouldn't take it. I know for quite a long time afterwards, when she had a stroke, I would blame myself. I would think, I should have made her take her medicine. I should have. And I beat myself up over it. Because I know what she needed to take. It was told what she needed to do, and she wouldn't do it. But I didn't really think at the time I thought, well, maybe she wouldn't take them today, and maybe she'll take them tomorrow, and so on and so on. but it kept being pushed out more and more and more. And that still hurts. It does. Because I would figure that maybe I would need something. Maybe I would find some way of getting her to take her pills. But then I began to realize really two things. Number one, that I couldn't follow the plan that she would normally do because I've learned that giving her all those pills at one time, and no doctor had to tell me this, but just noticing how she'd react, I began to understand why she wouldn't want to take the pills. When she had her massive stroke, and they said she had an infection, there was something else that was going on with her too. That her entire gastrointestinal tract was highly inflamed. So she couldn't keep anything down. She'd throw it up. And as she threw up, of course, it would scar her esophagus and so on. So she really didn't want to eat. And so she would begin, as she was having the stroke, for weeks afterwards, she really wouldn't eat very much, maybe 1 or 2 bites, and that's it. And I could see her wasting away in the hospital. And the doctors, they'll come and check her and they say, well, if she doesn't eat, then we'll have to do more invasive measures, feeding tube or something of that particular nature. And I didn't want that to happen to her. It's funny that eventually that did happen for a couple of weeks last year, but it was for something entirely different. It was because she had a seizure and her throat closed up, so she couldn't really take food. She had to use this feeding tube as well as a breathing tube as well. She had to get extra oxygen. I remember that period also because of something else that I really wanted to talk about today, and just for a few moments. Wanted to talk about, essentially, she would say, you're not a doctor. And again, it used to bother me, but after a while I began thinking, no, I'm not a doctor. I'm not a healthcare professional. I just do what I'm told to do. And I'm hoping and praying it works. In other words, I have no idea what I'm doing. And I have to admit that. That my baby's under my care. And I really don't know what I'm doing. But I stay faithful to what has been told me to do. And everyone tells me that she looks good. She looks fine. And I guess that she does. Then I remember what she used to do. I would tell people, almost like I'm bragging about what she used to do and how much she could do and what she would push herself to do. And it wouldn't be like a source of pride, but a source of, she really gave a lot. She really, really gave a lot. And I've actually begun to embrace what she said. I'm no doctor. And she's absolutely right. I am no doctor. I've learned some things. I've learned which pills that she absolutely must take. I've learned some pills that she can get away with not taking really if it's a day or two. And I proceed accordingly. I learned what hurts her and what doesn't hurt her. I learned that essentially that when the reason why they have fistulas, these people that have dialysis, their fistulas, is that they have brought two blood vessels to the surface, an artery and a vein, and then they take those two vessels and they puncture it with a needle, not the needles that we would normally get for a shot. That, let's say you want to get a vaccine, none of that. Pretty big needles. That essentially, if you didn't stop, it would end up with a lot of blood being on the floor. There have been some times where they really couldn't find when they would try to take her off, and they would put gauzes on it. They didn't put the gauze in exactly the right place, and you could sometimes see the blood spurt. Freaked me out for a little bit, but then they learned that they have to put it right on the wound, and you can't have the vessel move here and there, or else, it would be absolutely no good. You just bleed. And in that case, I've also learned how to use shout because if her clothes get bloody, then I have to be able to clean them up so I can use them again. And I use shout when I wash the clothes, and it comes out pretty good. I've learned, especially if I get it done within a reasonable amount of time. But I understand that I'm no doctor. And it's not that I've embraced it, but I've accepted it. I am no doctor. I try to do what I can, and to be honest, I don't know what's going to happen in the future. I don't know if she's going to live another day, another year, another 10 years, another 20, 30, 40, 50 years. I don't know. I sometimes joke that I'm probably passing away before she does. We're both in our 60s now. And we've lived a good life. This year will be 40 years of marriage. And I would not change a thing. Because I've learned so much while I've been with her. But the idea that I'm no doctor, I understand it now. I can't think I'm this wonderful person who understands what's taking place. I don't understand what's taking place. I don't know why these things are taking place. Except, again, from what the doctors tell me. I do what they tell me to do, and it seems to be working. So I keep doing it until they tell me no, or until I see something's going on and there shouldn't be, so then I consult with the doctor some more, that they change something. Like she gets tested, but every month or so at the dialysis clinic. They take readings of her levels of minerals and so on. And currently I'm working on her phosphorus. So her phosphorus is too high. And I found out that phosphorus occurs in, let's say, things like mashed potatoes. So I've cut down on the mashed potatoes. And something else happens when she gets colas. And she used to love Diet Coke or Coke Zero, but she couldn't even take those things. Hence, she takes the juices. But the juices I got to be careful about, because the juices, of course, has sugar. And if I give her too much sugar, then of course her blood sugar goes up. And then she's using up the insulin at an advanced rate, which she really shouldn't be doing. So all these things I have to kind of think about, balance it out. It's not a strain on me, at least not yet. But the idea that I'm not a doctor takes whatever pride I may have off of me and it places it on God. Because he's the one that's allowing her to stay with me. He's the one that allows her to respond to what I do. Every week, one night a week, or one day a week, we get a caregiver. Because I really can't afford to pay 7 days a week. So I figure I can do it one day a week, and that one day I may have a little bit of a rest. But I've learned that essentially she doesn't want to really see different people. And so she'll look at you like, what are you doing here? Why are you here? And I've let her know this is her caregiver. But I have to be there when the medicines are taken because they want to give it to her all at once. No, you have to give it to her. I give her 3 pills at a time. Pills, drink. Pills, drink. And they'll tell me, well, you can always smash the pills. No, I don't tell them, but I've already done that. And I know she doesn't like to get the smashed pills mixed with applesauce. Now, I'll do it, but it's only when she really can't take any pills. She can't swallow any of them. What she does now is that she takes the pills in her mouth and she tries to crunch them. But I said, you know what? As long as it's all going down the same place, I don't care. That'll work. And the pill that she is supposed to swallow, I just tell her, telling her to swallow doesn't really work, I found out. But telling her to wash it down with the juice, that works. So she's been getting the pills down too, and the capsules down. Whatever she can't do there, I have a liquid solution that I also give that to her as well. So, especially at night, it's usually pretty tight regimen, but it's done. But I don't glory in it because of what I've done, because as she would say, I'm no doctor. And she's absolutely right. I am no doctor. I'm just a husband trying to care for his wife. Some people say that's supposed to be special. I just say that's what I'm supposed to do. I don't know why we would expect to do anything else. If you committed to a vow that you made before God and man, then to honor, to love, to hold, to keep, in sickness and health, for better, for worse, richer or poor, till death do you part. Not death that I try to push on her, but death is coming naturally. But that's all I'm doing. That's not special. That's what I'm supposed to do. It's like with Jesus. I'm not celebrating my relationship with Jesus in terms of, oh, I'm a great person, I'm a Christian. No. That's what I'm supposed to do. Why? If I love Christ, that's what I'm supposed to do. And of course, to keep yourself from going to the other place. But I just thought that you should know that essentially, as a caregiver, my job is to watch over her. I'll leave her for a little bit of time to get something to eat. And I always pray, Lord, help me to make it back in case anything's happening to her. And most of the time, nothing's happening to her. There have been a few times where and I have to be careful. I said, oh, Lord, I forgot to put the bar on the bed. And she's leaning in a dangerous position. I have to say, oh, I'm so sorry. And she's looking at me like, did you forgot again? And she's almost about to cry. I said, Lord, I'm sorry. I have to apologize to her. So yeah, I make mistakes. I'm hoping that my mistakes are not lethal, that they're not, they don't hurt her for any period of time, that I can correct them. I know how horrible I would feel if any of that happened on my watch. So I try to watch her on my watch. And so far, so good. But as they say, I am not a doctor. Well, put it this way, I'm not a medical doctor. And because of that, it keeps me humble in a way that essentially it's not just fake, but it's, Lord, I thank you for regulating her system. Thank you for all these pills that the way I'm able to give it to her right now, it doesn't irritate her system. It doesn't essentially cause her throat to close up or anything else. If there's anything wrong with her digestion, I can sort of regulate or adjust certain things I'm giving her to help her be able to go smoothly. But all these things that you think about, it's not really a burden because I have to think about this too. And I thank God all the time. Every day I thank him. I retired at the right time, and God knew why I needed to retire. I didn't know. I just thought we would just be able to enjoy each other and go various places, but that wasn't the reason. God foresaw this and knew I had to be ready and knew that I could not work and do this at the same time. I would crack up. God knows my weaknesses too, as well as my strengths. And so he allowed me to retire. I don't make as much as I used to, but I make enough. And it's okay. I know I'm going to have to need some extra funding at some time in the future, especially when I get into my upcoming back surgery. But I'll take care of that when the time comes, and I'll prepare for that. But in terms of what I'm doing now, I'm with her, understanding what she does and how she does things and what I need to do. I'm not perfect, but I do help. And I'm thanking God for the opportunity to help her. Because, as you may know, I'm no doctor. But I know one who is. Love you all. God bless you. Take care of yourselves. In Jesus' name.